Hello. We're glad you're here to learn about microvascular diseases that are associated with diabetes. In this lesson, we will be discussing microvascular diseases that are often caused by uncontrolled diabetes. We'll cover the different types of microvascular diseases and ways to prevent them from developing or worsening. Microvascular disease is a condition that affects the smallest blood vessels in the body, known as capillaries. In diabetes, high blood sugar levels damage the endothelium, the inner lining of the blood vessels, causing endothelial dysfunction. This dysfunction is a key factor in the development of diabetic microvascular disease. The most commonly affected areas are the eyes, retinopathy, kidneys, nephropathy, and nerves, neuropathy. Diabetic retinopathy is a general term that refers to damage to the retina, the thin layer of tissue at the back of the eye that is sensitive to light. It is responsible for converting light rays into signals that the brain can interpret as images. Diabetic retinopathy is a common complication of diabetes and the leading cause of blindness in adults. High levels of blood glucose in diabetes can damage the tiny blood vessels in the retina, causing them to leak or become blocked. There are two main stages of diabetic retinopathy. 1. Nonproliferative diabetic retinopathy, NPDR. This is the early stage of the disease where small blood vessels in the retina start to leak blood or fluid, leading to swelling in the retina and formation of deposits known as hard exudates. This stage can progress from mild to severe, depending on the number of blood vessels affected. 2. Proliferative diabetic retinopathy, PDR. This is the more advanced form of the disease and is characterized by the growth of new, fragile blood vessels on the surface of the retina. These new vessels can bleed into the vitreous, the clear gel that fills the center of the eye, leading to serious vision problems or even blindness. Additionally, the growth of these new vessels can lead to scar tissue formation that can cause retinal detachment. Diabetic retinopathy often has no early warning signs, making regular eye exams crucial for early detection and treatment. Effective management of diabetes. That is, controlling blood sugar levels, maintaining a healthy diet, regular exercise, and taking prescribed medications can help prevent the onset and progression of diabetic retinopathy. Control of blood glucose levels, blood pressure, and cholesterol is crucial in the management of microvascular complications in diabetes. Regular screening for these complications is also important for early detection and treatment. Treatments for the condition may include laser surgery, injections of medications into the eye, or a surgical procedure called a vitrectomy. Diabetic nephropathy. Diabetic nephropathy, also known as diabetic kidney disease, is a serious complication of diabetes that affects the kidneys. It is characterized by the gradual loss of kidney function due to long-term damage to the small blood vessels in the kidneys. High blood sugar levels in individuals with diabetes can cause damage to these blood vessels, impairing the kidney's ability to filter waste and excess fluids from the blood. Initially, this leads to albuminuria, excessive amounts of the protein albumin in the urine, and over time can progress to end-stage kidney disease requiring dialysis or a kidney transplant. Risk factors for diabetic nephropathy include poor control of blood sugar and blood pressure, smoking, and a family history of kidney disease. The condition often has no symptoms in the early stages, but as kidney function deteriorates, symptoms such as swelling in the legs and ankles, fatigue, nausea, and frequent urination may occur. Management of diabetic nephropathy focuses on maintaining control of blood sugar and blood pressure levels, often with the use of medications. Regular screening for kidney function and protein in the urine is important for early detection and slowing the progression of the disease. In severe cases, dialysis or kidney transplantation may be necessary. Diabetic neuropathy. Diabetic neuropathy is a type of nerve damage that can occur in people with diabetes. High blood sugar levels over time can damage the nerves throughout the body, but diabetic neuropathy most often affects nerves in the legs and feet. There are several types of diabetic neuropathy including peripheral neuropathy, the most common type, causing pain and numbness in the extremities, autonomic neuropathy, affecting the heart, bladder, stomach, intestines, sex organs, and eyes, proximal neuropathy, causing pain in the hips, thighs, or buttocks, and focal neuropathy, affecting a specific nerve, often in the head, torso, or leg. Symptoms vary depending on the type of neuropathy and the nerves affected. They can range from pain and numbness in the legs and feet to problems with the digestive system, urinary tract, blood vessels, and heart. In severe cases, diabetic neuropathy can cause foot ulcers and infections, potentially leading to amputation. Managing blood sugar levels is key in preventing the onset and progression of diabetic neuropathy. Treatment typically focuses on slowing the progression of the disease, relieving pain, managing complications, and restoring function. Regular foot care, physical therapy, medications for pain relief, and in some cases, surgical procedures can be part of the management plan. Regular checkups are essential for early detection and treatment. Complications of diabetes, including heart disease, stroke, kidney disease, vision problems, and nerve damage, can be serious and life-altering. However, with careful management of your diabetes, you can greatly reduce your risk of developing these complications. Maintaining proper control over blood sugar levels is essential in preventing the onset and advancement of diabetes complications. Here are several steps you can take to prevent diabetes complications. Regular blood sugar monitoring, ensure they're within your target range set by your doctor. Healthy eating, eat a balanced, healthy diet. Regular exercise, aim for at least 30 minutes of moderate exercise, like brisk walking, every day. Avoid tobacco and limit alcohol. If you smoke, work on a plan to quit, and if you drink alcohol, do so in moderation. Manage stress. Stress can have a negative impact on your blood sugar levels. In addition, medication management. Ensure you take medication exactly as directed by your healthcare provider. If you have any side effects or complications with your medication, talk to your healthcare provider as soon as possible. Regular checkups. You should also have regular eye exams, foot exams, and screenings for other potential complications. Control blood pressure and cholesterol. Regular exercise, a healthy diet, and prescribed medication can help control these levels. Dental hygiene. Regular brushing, flossing, and dental checkups can prevent these problems. Vaccinations. People with diabetes are more susceptible to certain illnesses, such as the flu and pneumonia. Regular vaccinations can prevent these illnesses. Furthermore, remember, everyone's body responds differently to lifestyle changes and medication. It's important to work closely with your healthcare provider to create a diabetes management plan that's right for you. In conclusion, in order to prevent or stop the progression of microvascular complications of diabetes and other diabetic complications, it's essential to maintain near normal levels of blood glucose. Contact your healthcare provider to learn how to take control of your blood glucose levels. I have created this information as a part of my postgraduate diploma in diabetes coursework. Thank you for your attention.